Right now, 4:47 in the afternoon, we'll turn to 5 on your health. And the local threat right now from mosquitoes, and maybe you're not thinking about it, but state health officials say they are still biting. But and don't be alarmed, because for the last 2 weeks, there has been no sign that they're actually spreading disease at this point. So joining us right now is Dr. Todd Ellerin, South Shore Health. Great to see you, Dr. T.
Good to see you, Eddie.
Around here, we worry about two viruses from mosquitoes, right? West Nile and Triple E. So let's take a look at the numbers as we sit right now. There have been 8 confirmed cases of West Nile, none since September 25th. And with Triple E, there have been 0 infections this year. So how does that compare to other years? Where are we compared to other years?
In Massachusetts, it's milder. In the U.S., things are up 40% with West Nile virus.
Really?
Yeah. But in Massachusetts, you know, there's been 8 cases this year. There were 19 last year, but 8 cases tends to be an average year. With Triple E, which is a much more severe virus than even West Nile is, the good news is there have been 0 cases this year. Last year, there were 4 cases and 1 death. So it's milder so far, but, you know, we're still not out of the woods.
So, to that very point, let's take a look at the latest risk map for West Nile across Massachusetts. The red areas are still high, and it's still high in those red areas, which is, as you can see, mostly west of the city, although it does flirt right with Suffolk County in there. When will it be safe for the communities to relax? When can you relax?
Okay, so can't relax yet, but
right.
Once there's a hard frost, now when you read certain reports, it sounds like it needs to get to 28 degrees Fahrenheit for at least 3 hours, or below freezing for consecutive days. So the temperatures are going to drop, but just because they drop transiently doesn't mean we're, you know, out of the woods. But here's the good news.
Yeah.
Almost 90% of West Nile cases occur in August and September.
Right.
So things should be winding down.
So calendar-wise, we are clear of that. All right. It's a simple question. Is bug spray still the best way to stay safe?
Without question. See, the issue is these numbers aren't huge with West Nile, but, you know, I've seen a case in an elderly patient, not this season, but the patient did not leave the hospital the same way they went in. Oh. And so it's very preventable. Bug spray works. We talk about DEET, 30%. You want to apply it to exposed areas, you don't put it under your clothes. If you're wearing sunscreen in the summer, you put it over the sunscreen. And the important thing is you want to avoid, you know, the key times when mosquitoes are out there, between dusk and dawn. So especially if you're elderly, because those are the patients that are going to have the most severe outcomes, you want to make sure that you're applying that type of repellent.
And we're bringing the reminder because, yes, we are out of September, but you know what? It's still, what is it, 75 degrees outside? It's still warm outside.
It's a beautiful day. Mosquitoes are still out, so there's still risk. But not something that you have to be super concerned about. The numbers in Massachusetts have been low.
Dr. Allen, great to see you.
Good to see you.
To you.